student, dear friends, this is Rakesh Mankothari, lecturer of physical education from Government Co-ed Sarvodaya Vidyalaya, Rampura, Delhi. Welcomes you on behalf of Physical Edupedia. Today we are going to discuss the chapter number 3, Yoga and Lifestyle, in which we will discuss the lifestyle disease, diabetes and hypertension, and the asana which we perform to control diabetes and hypertension, their procedure, benefits and contraindication. So first of all, we must know about what is diabetes.
Diabetes is a disease in which glucose, or sugar levels, are above normal in the blood. Most of the food we eat is turned into glucose that our bodies use for energy.
What is glucose? You see, this is called glucose.
The pancreas, an organ that lies near the stomach, makes a hormone called insulin that helps glucose get into the cells of our bodies.
Pancreas secretes. There are two types of diabetes.
When you have diabetes, your body doesn't make enough insulin.
1.
Or it can't use its own insulin as well as it should.
2. The type 1 diabetes.
This causes glucose to build up in your blood.
Glucose build up in the
There are several
blood.
types of diabetes. In type 1 diabetes, the body does not make insulin.
The body doesn't make insulin properly.
In type 2 diabetes, the body does not use insulin well and may not make enough insulin.
The cell of
This
the
is
body,
the most common form of diabetes.
the cell of the body doesn't recognize the insulin properly, and this is most common diabetes.
Gestational diabetes happens when a woman's body does not use insulin well while she is pregnant. It raises her risk for type 2 diabetes and raises her child's risk of getting diabetes.
We can see gestational diabetes in pregnant women.
Diabetes is serious. Over time, high blood glucose levels may cause many health problems, including heart disease, blindness, kidney failure, and foot sores and amputations.
So we have discussed about the diabetes. Now, what type of asanas we can perform to control diabetes? So, dear student, there are 4 asanas in our syllabus: Bhujangasana, Paschimottanasana, Pavanmuktasana and Ardhamashendrasana. Some videos, so please, you are requested to pay attention. Check the procedure, contraindication and benefits. The Bhujangasana.
Bhujangasana. Bhujang means cobra. While doing this asana, the upper portion of your body is raised above the ground in the same way a cobra raises its hood.
This is procedure.
To do this asana, you will first have to come in the Makarasana pose, for which you will have to lie down on the floor on your stomach.
Listen
and
carefully.
Keep your legs at a distance from one another. Rest your head on your palms and relax your body. Now moving on from the Makarasana, bring your legs close to one another and stretch your arms in front of you. Rest your head on the floor. Now place your palms close to your chest and raise your elbows.
Inhale.
While taking a deep breath in, raise your chin up and lift your body up from the floor till your navel area. Take care that your elbow is in line with your body and your legs are stretched in such a way that you do not feel too much pressure on your waist. Breathing in and out normally, stay in this posture for about 15 to 30 seconds.
And the benefits?
Practicing this asana regularly gives relief from incessant back pain.
Benefits.
Bhujangasana reduces stomach fat and provides relief from constipation. This asana also helps in providing relief from breathing-related problems. Patients suffering from hernia or ulcer and pregnant women should refrain from doing this asana. If you have just had a stomach operation, then you should refrain from doing this asana for at least 3 months.
These are the
Stay in
contraindications.
this posture for 15 to 30 seconds. Exhale slowly and bring the upper portion of your body down to the floor. Stretch your hands in front of you and come back again in the Makarasana pose and relax your body.
Dear student, we have discussed the Bhujangasana procedure, benefits and contraindication. The next asana is Paschimottanasana. Here the same we will see the procedure, benefits and contraindication. Now the video we will watch here only the procedure, then we will discuss the benefits and the contraindication. Procedure of Paschimottanasana.
Sit up with the legs stretched out, straight in front of you, keeping the spine erect and toes flexed towards you. Inhale. Raise both arms above your head and stretch up.
Inhale and exhale.
Bend forward from the hips.
When we are bending
Chin
forward,
moving towards the toes.
exhale.
Hold the right wrist in front of the feet or place your hands on your legs wherever they reach without forcing.
Breath will
Place
be
your head to the knees or shins.
normal.
Long exhalations. Stretch the spine forward, reaching towards the legs with your head. Breathe.
Normal.
Stretch the arms out in front of you.
Again inhale.
Inhale. Come up to the sitting position.
Then exhale.
Exhale. Lower the arms.
Tanasana. Now the benefits. It improves digestive system. Paschimottanasana improves respiratory system. Benefits. Women during menstrual disorder. Helps as therapy for diabetic patient with weak liver and kidney. These are the contraindication of Paschimottanasana. We should not do Paschimottanasana if we are having the slip disc problem. If we are having hernia, we should not do this. Pregnant women avoid this pose. Persons having spondylitis should avoid this pose. Now the Pavanmuktasana procedure, benefits and contra.
Pavanmuktasana. Pawan means wind in English, and mukt means freeing or releasing. This asana helps in removing wind or flatulence from your intestines. Lie down on the floor with both your legs and hands spread at a comfortable distance from your body.
Procedure.
Ensure that the palms of your hands are facing upwards. This asana is called Savasana. Now moving forward from Savasana, join both your legs, bend your knees and take your thighs close to your chest. Interlock the fingers of both your hands together.
Take a
and
deep
hold
breath.
them below your knees near to your shins.
Press it.
Now while breathing out,
Then
lift your head
exhale.
and shoulders till your chin is touching your knees.
Maintain this pose.
While doing this, you will experience stretching in your lumbar region. Keep your eyes closed and focus your thoughts completely on your lumbar region. While breathing in and out normally, stay relaxed in this pose for some time.
Now the benefits.
Pavanmuktasana gives you relief from flatulence and decreases the bloating sensation in the abdomen. This asana cures you from constipation and improves the digestive process. Pavanmuktasana tones up your spinal nerves.
Strengthen
This asana strengthens the muscles of your back.
all the back muscles.
Pavanmuktasana offers deep internal pressure, massage, and stretching of the highly complicated network of muscles,
Strengthen.
ligaments, and tendons in your pelvis and lumbar regions.
Now the
Refrain from doing
contraindications.
this asana if you are suffering from back pain or stomach injuries. Patients suffering from hernia and sciatica should refrain from doing this asana. Pregnant women should avoid doing this asana. After staying in this pose for some time, while breathing in, rest your head and shoulders on the floor again. Now, while breathing out, straighten your legs, keep them on the floor, come back to the Savasana pose, and relax.
Very well explained the procedure, benefits, and contraindication of Pavan Muktasana. Now we will discuss the Ardha Matsyendrasana, its procedure, benefits, and contraindication. First of all, we will see the procedure in a video, then we will discuss the benefits and contraindication. So, first of all, the procedure of Ardha Matsyendrasana. This is also called the half fish pose.
Bend your right leg. Bring your left foot around the right knee corner. Take your left hand back. Stretch your right arm up. Push your knee back using your elbow and hold your right foot. Look back over your left shoulder. Ardha Matsyendrasana. Stay there for a few breaths. And slowly come out the same way.
We can repeat this from the other side also, left side. First we have done this pose from right side, then we can repeat it from the left side. The benefits of Ardha Matsyendrasanas are: it controls secretion from pancreas gland, reduces fat and helps in controlling obesity, helps nervous system and strengthen the backbone, helps to make hips stronger and tone. And the contraindications are: we should not do this asana if we are having the slip disc problems. We should not do this question. Explain the procedure and benefits of Pavan Muktasana in detail. The question number 2 is: what are the benefits and contraindication of Paschimottanasana and Bhujangasana? And list the asana which are used to control diabetes. Briefly discuss 2 of them in detail. The last question is: diabetes is common lifestyle disease. How it can be prevented through practicing of different asana? You can find these questions in CBSE or in half yearly or pre-board. Now the next one is hypertension. Same way we will see first a video regarding hypertension.
It pumps blood round your body. As the blood moves, it pushes against the sides of the blood vessels. The strength of this pushing is your blood pressure. As your heart pumps, the flow of blood in your arteries and your blood pressure rises and falls in a regular wave pattern. Blood pressure is shown as 2 numbers. The top number, or systolic pressure, is the pressure when your heart beats. The bottom number, or diastolic pressure, is the pressure when your heart relaxes. Healthy blood vessels can stretch to allow for these changes in pressure. Damaged blood vessels are less stretchy, which increases blood pressure. Constant high blood pressure puts extra strain on your heart and blood vessels. Over time, this increases your risk of a heart attack or stroke. It can also cause problems for your eyes and kidneys. High blood pressure speeds up the process of atherosclerosis, where fatty streaks form inside the arteries. If one of these cracks, it can cause a blood clot in your arteries. This is what causes a heart attack or stroke. It's never too late to make changes to protect your heart. Think about your future, being there for your family, your plans and dreams. Could your blood pressure affect this? There are small steps you can take today to lower your risk. If you smoke, stop smoking. Make heart-healthy eating and drinking choices. Move more, lose weight. Talk to your doctor about medication.
So the hypertension, a condition in which the force of blood against the artery walls is too high, that is called hypertension. Now we will discuss some asanas which we can do to control these hypertension. Dear student, we have discussed already the Vajrasana in obesity, Pavan Muktasana and Bhujangasana procedure, benefits and contraindication for diabetes. Now we will discuss the Tanasana, Ardha Chakrasana and Savasana. So first of all, we will discuss Tadasana, the procedure of Tadasana.
Tadasana. Tad means palm tree. While doing this asana, your body posture becomes tall and strong, like the palm tree. To do this asana, first stand straight with both your feet at a distance of 2 inches from one another. Now, lift your hands till your shoulders. Keep your palms facing each other, and then interlock your fingers together. Now, slowly bend your wrists outwards. Now, taking a deep breath in, slowly lift your arms up above your head while keeping them in line with the shoulders. Keep your body steady in this position. Now, slowly raise your heels up from the ground and stand on your toes. Without losing your balance or moving your feet, stay in this position for about 10 to 15 seconds. Breathe in and out normally. Stay
Benefits.
still in this posture. It might be a little hard to maintain your balance in the beginning. To help achieve this, you can try focusing at a single point in front of your eyes. Doing this asana regularly will help you improve your balance. This asana helps in getting rid of congestion in your spinal nerves. It helps to improve the posture of the body and also strengthen
And the benefits of Tanasana. Now we will discuss Savasana, its procedure and the benefits.
Slowly lie down on the back. Shanti Asana, relaxation pose. Keep your legs apart, your arms apart. Gently close your eyes. Keep your breathing normal. Relax your awareness. Relax your concentration. Spread your relaxed awareness to the whole body. Bring your awareness to the forehead, your eyebrows, your eyes, your nose,
We should relax
your mouth,
all the body parts,
your ears,
all the body parts.
your neck,
Inhale,
your shoulders,
exhale,
upper arms,
all the body parts.
elbow joints,
Relaxes,
lower arms,
relaxes.
your wrist,
Every asana
your palms,
we have to perform Savasana.
all the fingers.
After every asana we have to perform Savasana.
Slowly move your awareness to the chest, the back of your chest,
Savasana is very important for hypertension.
the upper abdominal area,
It can cool down, calm,
the lower abdomen, the lower back,
all the body part relaxes whole body, releases stress, fatigue, depression and tension. It's calm and mind and improve mental health. So dear student, we have discussed Savasana and Tadasana for hypertension. Now we will discuss about the Ardha Chakrasana.
Ardha Chakra Asana.
Ardh means
While doing
half.
this asana, the posture of your body is like a half chakra or like a half wheel posture. To do this asana, first stand in a straight position. And
Procedure.
place both your hands on the waist to give it support. Take care that all your fingers are joined together, which then will give proper support to your waist. Now, take a deep breath in and slowly bend backwards from your lumbar region. Bend your head backwards to the point till it stretches your neck muscles.
Stay maximum there.
Breathe in and out normally. Stay still in this posture for about 10 to 30 seconds.
Breathe normally.
Ardha Chakra Asana makes your spine flexible.
Benefits.
It strengthens your spinal nerves. This asana improves your ability to breathe. It also reduces pain caused by cervical spondylitis.
Now we will discuss some questions, the MCQ, which may be asked in CBSE half yearly or pre-board examination, dear student. The first question is select the asana which help to reduce hypertension. We will discuss here only regarding the diabetes and the hypertension. The answers are Chakrasana, Trikonasana, Ardhamashendrasana. Options are Savasana. So Savasana is the correct answer. The second question is if pancreas not produce enough insulin, it may leads to diabetes is the correct answer. The third question is choose the asana which is not performed for hypertension, that is Salabhasana, which is not performed for hypertension. The fourth one is pick the correct one lifestyle disease. The four options are here. The correct answer is hypertension. The next practice question for 3 marks and 5 marks question, 5 marks. Elaborate the role of Ardha Chakrasana and Savasana to prevent hypertension. We can write it in two parts. So there will be 1.5, 3 marks question. Question number 2, briefly explain any two asana for hypertension. Any two asana means 1.5 and 1.5. That's mean 3 marks question. The next one is enlist the asana which helps to reduce hypertension. Briefly discuss two of them in detail. Enlist the asana 1 marks question. Two of them in detail 2 plus 2 5 marks question. The next question is define hypertension. It is 1 marks. Enlist the asana used for hypertension. Briefly explain any two asana means 2 plus 2 5 marks. We must know the bifurcation of the question also, dear student. So that's it. This was for the diabetes and hypertension. In next video we will discuss about the asthma and back pain. If you have any queries, you can write in the box. We will solve that. We will try to solve it. And if you want to see the chapter number 1, 2, 3, 4, you can go to description and you can click the link of that topic and you can watch that. Thank you so much.